Each month on Smart Medicine, we give you the chance to ask the expert. This month's topic, diabetes drugs. And joining me now is pharmacist Clara Nicholson. And Clara, thank you for joining us.
Thank you for having me.
Well, let's talk about diabetes drugs. There are so many medications available today. Why is that?
There's a lot of different medications because we've learned so much about diabetes through the years. It started off, we were focusing in on making more insulin, so the original diabetes meds focused on that. From that time, we've learned more about insulin resistance, needing to improve the way insulin works, and so the newer drugs focus in on that. So they help target different areas. For that reason, a lot of times we use them in combination. A lot of patients will ask, why am I taking multiple drugs for my diabetes? And it's because they all target different ways, so when we use them together, then we can get the best outcomes.
And how do physicians determine which meds to prescribe?
There's a lot of things your doctor is going to take into consideration when they're deciding what medicine is going to be best for you to treat your diabetes. Some of these include some of the side effects of the medication. Some of them can actually cause a weight increase, so that may be an issue, so they'll want to use some that maybe can cause a weight decrease. And there's going to also be things to take into consideration, like if your kidneys are working okay, if your heart's working okay, if your liver, and those type of things. So then the doctor's going to weigh all those when they're trying to decide which one's going to be the best.
Case by case.
Case by case, exactly.
Are there any differences in types of insulin?
There's several different insulins, and they've progressed. That's another area they've come a long way with through the years. Some of the insulins that we're using now, we use long-acting, where they work very slowly, and they last throughout the day. We can also combine that with some that start working quickly, wear off sooner, and so we can tailor that, and again, get very individualized treatment depending on how a patient's glucose is doing.
Well, Clara Nicholson, thanks so much for joining us.